Health is nowadays one of the most widely spoken topic in the world. So, good evening viewers, welcome back to yet another episode of BMC Global Live AL-HILAL Health World, an exclusive health talk with doctors from AL-HILAL Hospital and Medical Center. Myself, Marina Francis. So, in today's episode of Health World, we are having a continuation of last week's episode, wherein last week we dealt with hypothyroidism. And so today we are dealing with yet another thyroid disorder, that is hyperthyroidism. So once again I am very happy to welcome Dr. Vidya Vijayan to our episode. She is a consultant in internal medicine with over 8 years of experience in the field. She is currently working at AL-HILAL Hospital, Muharraq branch. So let us move ahead with the discussion on hyperthyroidism. Doctor, once again welcome back to Health World.
Thank you.
Good evening. How are you doing, doctor?
Doing great. How about you?
I am also good, doctor.
Yeah.
So, doctor, in last week's episode, we had a huge discussion on hypothyroidism.
Yes.
So, another thyroid disorder, that is hyperthyroidism.
Okay.
A brief elaboration on that.
Yeah. Last week we discussed about hypothyroidism, and today we are here to discuss about hyperthyroidism.
Okay.
So this is a state where your thyroid gland produces more amount of thyroid hormone
Okay.
than
Opposite
your
to the-
body requires. Okay. Oversecretion.
Okay.
Yeah, just the opposite of hypothyroidism. So
Okay.
that is the condition we call hyperthyroidism. Okay.
Okay. So, doctor, now what are the causes of hyperthyroidism?
Yeah. So hyperthyroidism, again the common causes Graves disease. Graves disease, or it's again an autoimmune condition. Okay. Here again our own body's own immune cells produce antibodies that triggers the thyroid gland to produce more amount of thyroid hormone.
Okay.
So this is one of the commonest cause of hyperthyroidism.
Okay.
Other causes are like there are, other than these causes, sometimes your thyroid gland can have some lumps and nodules. Okay. So some hyperactive or overactive nodules in your thyroid gland.
Okay.
Not cancer, other than that also non-cancerous nodules can be which produces oversecretion of thyroid gland, thyroid hormone. Okay. And sometimes thyroiditis, that is an inflammation of the thyroid gland, can also trigger to produce more thyroid hormone. Okay. And certain medications. Okay. And sometimes we were saying like hypothyroidism, we take treatment. No, sometimes overdosage of the medicine, self-adjustment of the levothyroxine tablets for hypothyroidism can also cause hyperthyroidism due to medicines. Other than this, some other medicines can also cause hyperthyroidism. Okay. And next is increased iodine in the diet also can cause hyperthyroidism.
Okay. Yeah. So, doctor, for hyperthyroidism, what are the symptoms that a person would show?
It is exactly the opposite of hypothyroidism.
Okay.
So last time we said in hypothyroidism the metabolism is slow.
Yes.
Okay. So here the thyroid hormone is more. So overall your metabolism is more. Okay. So what will happen? There is increased heart rate. Okay. So the patient will, you will feel palpitation, awareness of one's own heartbeat. Okay. Then weight loss.
Okay.
Weight loss, sweating, tremors, irritability, anxiety, altered bowel movements, lack of sleep. Overall you feel very horrible. The patient will feel very horrible in this state. Because all these symptoms are intolerable, like palpitation, weight loss, and sweating, tremors. So they will feel very tired and not good overall.
Okay. So what could be the risk factors that can trigger this hyperthyroidism?
Yeah. So some of the risk factors are like if this hyperthyroidism run in families, like suppose there is a risk of Graves disease in your family. Okay. So that is I told this autoimmune condition can also always have a genetic predisposition.
Yes.
So in such a state this can run in families. So this is a risk factor. If your family member or anybody has this, so there is a risk for getting hyperthyroidism.
Okay.
And other than that, for some people like who already have some other autoimmune diseases like pernicious anemia, type 1 diabetes and all, they also have a higher tendency to get hyperthyroidism. Okay. And other than that, if you ask me who all will get this, means whether this is common in females or males, if you ask me that, I will say again this is more common in females, but males can also get this, but more common in females. Okay. And yeah, that's all.
It can be even in children. It can
mostly,
be present.
yeah, can, but mostly in adult population.
Okay. So we covered up certain aspects of this condition, hyperthyroidism. We have to ask many other queries regarding the diagnosis and the treatment. So we will be back after a very short break. Don't go anywhere. Stay tuned. Welcome back. You're watching BMC Global Live Al-Hilal Health World, an exclusive health talk with doctors from Al-Hilal Hospital and Medical Center. So today we are here with the topic hyperthyroidism. Let's move ahead with the remaining queries. Doctor, so next I would like to ask you, how is this hyperthyroidism diagnosed?
Again, from the symptoms and physical examination, okay, your doctor will look for the thyroid gland, whether any nodules or enlargement of the thyroid gland, and then the definitive diagnosis is by doing blood test. Okay, here again we will do the TSH test, it is a thyroid stimulating hormone test. Here in hyperthyroidism, the level of the TSH will be very low. Okay, will be lower than the reference range. Okay, so in such a condition, we will diagnose it as hyperthyroidism. Okay, and other tests as we will go for to check the free T3 and free T4 level, whether these hormone levels are also high. Okay, and sometimes we will specifically order for few blood tests like antibody test. Okay, so this is mainly to look for the definite cause of the hyperthyroidism. We already discussed that, no, some causes like Graves disease, and also to look for that we'll search for the we'll check for the antibodies, specific antibodies, so to diagnose that, because you know, for it will help for the treatment. So that is the one thing, and sometimes we may have to go for imaging studies like scan of the thyroid gland. Okay. So that is the other one.
Okay. So doctor, once the diagnosis is done, how is the treatment options for hyperthyroidism?
Okay. For hyperthyroidism, again the treatment will vary according to the cause of the hyperthyroidism, and your age, and your whether you're pregnant or not pregnant, and so the main options are there are anti-thyroid medicines. Okay. So this is mainly methimazole and propylthiouracil. These are anti-thyroid medications. So this will prevent or will reduce your the thyroid gland to reduce the amount of thyroid hormone produced by the thyroid gland. Other option is radioactive iodine treatment is the so this is one of the other definitive and standard treatment of hyperthyroidism. But we cannot give during pregnancy and all. So other treatment, one other treatment is surgery. So but we always don't go for surgery. It again depends on the cause of the hyperthyroidism, and whether sometimes some patients may have some adverse effect to the other medications of hyperthyroidism, or they may not be able to take it. So in such a case only we'll take it as and the patient's choice. We'll test the last option, the surgery. And as we already said, there are the treatment options in that the anti-thyroid medications. There are two types, mainly methimazole and propylthiouracil. So especially like in pregnancy and all, when we give, we have to check, because one type of medicine you cannot give in the first trimester. So that your doctor, you have to see the doctor and the doctor has to decide. Okay, and so the first trimester will be giving only propylthiouracil, and the second trimester we may have to change it. Okay, so because there are some side effects for the medications, not like levothyroxine, which we discussed before in hypothyroidism. Here, even when you take the medicine, there can be some side effects which we will tell the patient. So, the antithyroid medicines for some can cause some allergies, and for some there can be a reduction in the white blood cell count. So, they may come with sore throat, recurrent fever and all. So, in such a case they should definitely visit their doctor when they are taking, when they have these symptoms while they take these medicines. Okay. So, definitely usually we will advise them, we will tell them once we start the medicine. So, you have to look for all these symptoms, and we will, when they come for the next visit, we will look at their WBC count and we will check whether they have all these symptoms or not. So, these are the main treatment options for hyperthyroidism.
Okay. Doctor, what could be the complications associated with hyperthyroidism?
In hyperthyroidism, we already discussed, like it can cause the abnormal heart rate. Okay. So, it can result in arrhythmias, that is like atrial fibrillation, that is your heart is not beating regularly, there is an irregular heart rate. Okay. So, this can result in cardiac failure, it can result in stroke. Okay. And other thing, osteoporosis, weakening of the bones. So, and very other dangerous condition is another very high level of thyroid hormone that can result in thyroid stone. So, these are the few complications of hyperthyroidism.
Doctor, what are the effects of hyperthyroidism during pregnancy?
Actually, yeah, hyperthyroidism itself can cause menstrual irregularities, and it can even cause infertility, one of the cause of infertility also. Okay. So, once they become pregnant, it's very important to check the, we already said, like in even when hypothyroidism, while we discuss, I said always now we are checking TSH level during pregnancy, because both hypo and hyper is not good. Okay. It is not good for both mother and the baby. Okay. When in hyperthyroidism, if the thyroid slight level of high is okay, but if it is very high, it is not good for the mother and baby. It can result in miscarriages or abortion, premature delivery, low birth weight babies. Okay. And mother can have very high blood pressure during pregnancy. So, overall this condition is not good. So, to check the level, and if the level is very high, you have to start medicine. Okay. So, and the reason is that as when I talked about the treatment options, I was saying there are some side effects for the anti-thyroid medicine. So, we cannot without the doctor's advice and all, you should not take the medicine as such, because during the initial stages, initial first 3 months, your doctor should advise, according to the level, what medicine she should take and the dose, everything. Okay. And even after delivery also, you should check your thyroid TSH level. Okay. So, whether to continue that, because this thyroid anti-thyroid medications, only with the doctor advice you should continue it. Okay. So, that is one thing. And after 6 months of your delivery, it is usually common to get hyperthyroidism due to a state called postpartum thyroiditis. Okay. After 6 months of delivery, usually ladies present with some symptoms like palpitation, fatigue and all. So, when we check the TSH level, there can be a abnormality. Okay. So, this condition is called postpartum thyroiditis, but this usually goes after few months. Okay. So, so initially we will check whether the level is too high, whether the patient requires the medicine. So, in such a case we may have to start, but sometimes after a stage this may go with for hypothyroidism. Okay, so then we may have to take the thyroxine, levothyroxine tablet.
Okay.
So it's very important to check your TSH level during pregnancy and consult your doctor if there is any abnormality.
Okay. So doctor, similar to hypothyroidism, for this hyperthyroidism also the medication, is it lifelong in most cases?
Like we usually start with this anti-thyroid medicine.
Okay.
So like not like hypothyroidism, immediately the symptoms won't go away. Okay, so it will take some time. Okay, weeks to months it can take. Okay, so we may try with this anti-thyroid medication for sometimes for 2 years and all. Okay, so usually if we don't get the cure, maybe we may not get a cure out of this. Okay, but the symptoms can reduce in Graves' disease and all. But if you don't get a proper symptom reduction or cure, then we have to go for another options like radioactive iodine, or in some cases, as I told, maybe we may have to go for surgery also.
Okay. So doctor, the surgical treatment option, once that is done, is it a complete cure for hyperthyroidism?
Yes, surgery will be a complete cure. But what it will result? It will result in hypothyroidism. That your thyroid gland is not going to produce anymore. So it can't result in hypothyroidism. So they may have to take the medicine for hypothyroidism. But relatively, hypothyroidism is very easy to treat. And less complications. So that is better. So they will continue with the medicine. As we already discussed, is nothing but the natural replacement of the natural hormone which we are lacking.
Yes.
So that's better.
Okay. So doctor, how important it is to test thyroid levels?
Yeah, so from all these last two discussions, you would have known. I think my viewers now, by this time, they will also know how important it is, because this is a very important hormone, very crucial hormone that controls our body's metabolism. So needed for each and every cell of the body, and function for all the organs. Okay. So overall it has effect on our function. So it is very important to check.
Yes.
So if we face any of these symptoms, you have to visit your doctor, check the thyroid level, because this is something that you can treat.
Yes.
And we can prevent the complications.
Okay.
So why to hesitate?
So doctor, is this TSH test available at your hospital, AL-HILAL?
Sure. These are very easily done in our hospital. You can come and do it, and there are a lot of offers also going on. You can do it in a very affordable price in our hospital, and you can easily see the doctor and get good advice from them.
Okay. So doctor, before we wind up today's episode, what is your final takeaway message to the viewers?
Hyperthyroidism is also a very common endocrinological condition we see in our clinical practice. So this has lot of complications also. So unless if it is not treated properly, it can result in many complications. So make sure you do the test and visit your doctor and get proper advice. Okay, thank you.
Thank you very much, doctor. This is the second time you joined with us. Thank you very much for coming again and answering to all our queries.
Thank you, Marina. It's my great pleasure, and I thank BMC for giving me this opportunity. Thank you.
Thank you, doctor. So definitely I hope these two episodes would have been quite informative for all our viewers. We will be back again in Health World episode next week as well with yet another topic and another doctor. Till then, this is Marina Francis signing off. Good night.